like to give a brief introduction of our respected sir. There is speaker, Dr. Aniruddha Malpani sir. He is an IBM specialist. He has passed out from Bombay University and he has won more than 20 gold medals in his academic career. Okay? He has authored many books, the most valuable like Successful Medical Practitioners, and all of these books are available on a website at free of cost. He has founded world's largest free patient education library named Help. Okay, there's a website for that also, www.healthlibrary.com. He is an active angel investor. He invests across all domains and admires entrepreneurs because Sir strongly thinks that everyone has a potential and have an impact to change the world. And the most important thing, he has founded the M.I.C.E lab in JJ Hospital, which is like designed to teach new medical budding students like you for the various creative and innovative works you can do. So Sir has already helped JJ Hospital a lot. So I would welcome Sir and request him to deliver today's topic, that is patient safety.
Hi, everyone's awake? And if you're not awake, then I'll wake you up. You know, they were going to give me a 12 o'clock slot for the lecture. I said, I'm not coming at 12 because everyone will be asleep. You heard a 9 o'clock lecture and then a 10 o'clock lecture and an 11 o'clock lecture. And I always tell people the best treatment for insomnia is not a diazepam tablet. It's to listen to lectures. You agree with me?
Yes.
Yes. I guess your whole head is just full of. How many of you went to Kota for coaching? Just out of curiosity. Oh, quite a lot. Why did you stay in Maharashtra? Aren't there good coaching classes in Maharashtra? No. So why did you decide who goes to Kota and who stays in Maharashtra?
All India volunteers.
Okay. So some of them will. Yeah, but every city now has coaching classes, right? So why do people still prefer going to Kota? I'm just curious. Yes. Sorry. But her tuition class in a locally competition. Okay, so local tuition classes are adapted for that local state exam. Is that what you're saying? तुम क्या बोल रहे हो कि जब दूसरे लोग का जोश देखते हो तो तुम्हारा भी जोश बढ़ता है? Okay. Right. I guess that's one. Let me see how. So just out of this thing, I was in the lift and there were some students coming for this lecture, and I was asking them how many of them are carrying laptops to take notes for the lecture. And the answer was 0, and I don't see a single laptop, and I don't see a single tablet here. I was just wondering why. How do you people make notes when you attend lectures? Everything's only in your brains. What? Oh, there is one tablet. Okay, good. So, yeah, again, like I was telling them, the trouble with notebooks is that's what your grandparents used to use. Your grandparents used the slate and the chalk, I guess. Your parents perhaps used pen and paper. Is there any reason you want to continue doing the same thing you did 30 years ago? How many of you use an Uber? You know what an Ola is? You know what an Uber is?
Yes.
Or you still all use black and yellow taxis?
Walking.
So why do I thought someone was going to say EV scooters, best of all worlds. My point is that everything has changed. I still cannot believe why you guys are not willing to change the way you learn. You cannot keep on doing the same things. So why do you keep on doing the same things anyway?
Sometimes they are effective.
Yeah, I'm not saying they're ineffective, but there are things which are better, which are more effective. It's not like black and yellow taxis didn't work. Before Ola and Uber, we would still catch black and yellow taxis, but there's a reason we move on and adapt. I think part of the problem is you're all brainwashed. You agree with me?
Yes.
You all behave like the herd. You all behave like sheep. You all do what everyone else does. Because that's what your parents tell you to do, that's what your teachers tell you to do. You do what everyone else does. Yes or no? Would you agree that's it? The only reason you went to quota is because everyone else was going to quota. The only reason you went to tuition classes is because everyone else was going to tuition classes. Is that what you plan to do the rest of your life? Do what everyone else is doing? Okay, what's the bet I come back here after 4 years and everyone will still be doing what everyone else is doing? And I think that's the one thing you guys need to change. Times have changed. You can't afford to keep on doing everything which everyone was doing exactly in the past. Someone was asking me the reason, yeah, we have tablets. Great. So why don't you bring your tablets to the lecture hall? Because our professors will shout at us and scream at us, tell us not to carry tablets. Why would your teacher shout at you for carrying tablets? As long as you're paying attention, as you're playing notes, why would anyone object to how you were paying attention? Would it make a difference, do you think? I guess their worry is you're playing games on your tablets and not paying attention to them. Is that right? But just because you have a notebook in front of you, you could still be doodling on the notebook. You could still be daydreaming. You could be playing noughts and crosses. So the point is, if you're paying attention, you choose to pay attention. Can I force you to pay attention? I can't force you to do anything. So if I'm a boring lecturer, if I'm a boring lecturer, in fact, I tell everyone, all attendance should be optional. If the lecturer is not adding any value to your life, you have better things to be doing. You should be hanging out in the canteen and making friends rather than listening to a lecture. So I have absolutely no problem. And honestly, I would rather have 5 students who are interested in what I was saying rather than have 50 students who came only because they needed to mark attendance. But okay. So coming back again, this is what I'm supposed to be talking about. So, sure. So this is what all of us think today, right? You managed to get into JJ Hospital, medical college. I'm sure your parents are very proud of you. I'm sure your grandparents are even more proud of you. Let's be honest. And I'm sure this is what you think of yourself. Yeah, all those other idiots in those quota coaching classes, all those A graders, they never got in. See how I cracked the exam and how I got it. Yes or no? You're all proud of yourself, right? And that's fine. I was proud of myself too, and I got it. I didn't know any better. I know a little better now. But of course, this is what the past 3 years of your life have been like this. 3 years, 4 years, 5 years. What? When did you guys start? 6th standard, 7th standard, 8th standard, 1st standard? No, not yet. I'm sure your parents had a choice. They mostly start you in the 1st standard. Yeah, this is what you think the rest of your life is going to be. This is what you're going to be like for the next 1 year, right? Everything has changed. Because most probably the guy who's sitting next to you has done far better in the NEET or whatever you call the exam than you did. So there used to be a time when you were the brightest. There was a time when you were the brightest person in class, right? You were the teacher's pet. Everyone came to you. What is the answer? How do I solve this? So your ego got really swollen. You had the biggest head in class. Now you come and find out, yeah, I'm not really that bright. There are lots of people brighter than me. And this is a bit what. How many of you have been ranked? Not yet. Not yet. I hope you do. There are 2 kinds of ragging. No, I'm serious about this. There are 2 kinds of ragging. No one really wants you to be physically abused. But I think ragging is a great way of breaking some of the barriers between, let's say, the 1st year and the 2nd year and the 3rd year. And it's unfortunately acquired a very negative connotation, which is sad. But you can learn a lot from your failures. So, this is the first rule of medicine. And immediately, if you remember nothing else from this lecture, and the reality is that you will remember maybe 5% of this lecture, not only will you forget the other 95%, you will distort half of it. And that's just the nature of the beast. So, there's one suggestion I'm going to give you guys. Whenever you attend lectures, identify one person in your class to be the note taker. That person can rotate in each class, it doesn't matter. The rest of you can chat, play games, and do whatever you like, it doesn't matter. If you find the lecturers interesting, feel free to pay attention. If you don't, feel free not to. It's your time, it's your life, it's not going to come back. But for the guy who takes notes, make sure he takes notes diligently, photographs, slides, shares it with everyone else. How many of you people share your notes with other students? I don't believe this. I honestly don't. Because the reality is all of us are so competitive that we think our notes are our property. And that's what's going to make the difference between who comes first and who doesn't come first. So we all are very selfish and we hoard our notes, which is actually not a very smart way. Because all this might work perhaps till you're in college. But the moment you get into real life, you will learn that cooperating is far more effective than competing. And that's why you should designate that one person who makes the notes and then shares it at the end of the day. Create WhatsApp groups, create websites, share all this stuff. Trust me, the more you share, the more you will learn. The best way to learn something is to teach other people. And the person who's taking the notes, his job is to then make sure that everyone understands. Because the reality is, suppose I say something you don't understand. What are you going to do about it, Alice? I say something and you don't understand. What are you going to do? You won't. You're scared. You keep quiet. You don't want to rock the boat, and not a lot of lecturers want to be disturbed in the middle of the lecture and they'll say, yeah, come and see me after the lecture or whatever. Isn't that true? The whole point of a lecture is to make sure that you get the information I want you to get. Is there any way of my being able to check whether you understood anything I've said? No. How?
Cross-questioning.
Yeah, but most people don't do that, right? Most people, even if I cross-question you, I could ask you questions. You might answer. How do I know whether she's understood? A lecture format is the worst method of teaching. And you know what the irony is? We all know that, and we all continue doing it. Hopefully, by the time you guys become teachers, things will have changed. I'm not very hopeful about that. But anyway, so this is the big paradox. To err is human. None of us are born like. And unfortunately, we are human. And it is true that errors will cause harm. And honestly, it's every doctor's nightmare. Why is it a nightmare? Because you know what happened to you? Yeah? How many of these newspaper articles have you sent? And the trouble with a lot of these articles is they're very distorted and they're very biased. Because they're usually produced by the press or the media who doesn't understand anything. And the worst is that all the judgments are given by judges who sit in ivory towers who don't understand what it's like to actually take care of patients in a busy hospital. And of course, after the event, everyone has 20/20 hindsight. Everyone is smart. All the clever cartoons are put up serves you right. So hopefully the next time you decide to sit in the front, you'll be able to laugh. But effectively, this is what happens. Errors kill, and these are US statistics. God only knows what the Indian statistics are, and I guess we'll never find them. So this is just a graph. Most health encounters or most visits are going to go smoothly. We sometimes forget that. And it's actually amazing that 99% of the time we see patients and those patients get better. Which, considering the fact that there's so many problems we deal with, that's still amazing. However, having said that, in a small proportion there will be errors. Not all errors will cause harm. Those are what we call the near misses. But there will be adverse events. Some will be preventable and some will not be preventable. And there's very little which we can do with the non-preventable adverse events. What does non-preventable mean? It means that when the patient is so sick that by the time the patient has come to you, doctors are not miracle workers and we're not gods. So if the patient is come in extremis, in a terminal stage, there's very little really. The problem is that when something happens to the patient, the relatives will beat you up. And even if the relatives don't beat you up, the judges will beat you up afterwards. Because what is their problem? They don't realize that these are non-preventable adverse events. In their head, every adverse event is a result of negligence. And that really is what we're trying to do. So again, I've broken up medical errors, errors of commission and errors of omission. Does everyone understand the difference? Straightforward enough. An error of commission is when you do something wrong. And an error of omission is when you forget to do something which is right. And again you break it up. What does unintended action mean? That you forget or you're not paying attention or you mess up because you're technically incompetent. And intended action means you make errors partly because you don't know any better. Because you didn't attend that particular lecture and because you didn't know in that lecture how you were supposed to treat someone with diabetes. I hope that teaches you why it's important to attend lectures. As long as you learn the stuff, it doesn't matter. So if you notice, Signal is my redundancy backup. I'm trusting a piece of equipment, I'm trusting a technological tool. But the problem is that technological tool doesn't always work. But instead of then fiddling around and working and getting angry and upset and walking out in a huff because things didn't work, you create alternatives. So ideally you should have two of these. So in case one didn't work because the battery died out, you have something else. And of course you always have humans. The one good thing in India is we don't have a shortage of humans. So make use of them. That's what I'm saying. Thanks. So errors are very common in hospitals and there are multiple reasons for this. Let's just go through all the reasons. Everyone's busy, it's complicated, there's too much work. But I think the last thing is something important, is the bossy seniors. Where I think sometimes what happens is seniors have very unrealistic expectations of what you're supposed to do. So they end up micromanaging you. Or they don't allow you to learn safely, as a result of which you keep on committing the same errors again. Next. Isn't this true? I know that's what I do. The first time I make a mistake, I say, कोई नहीं है ना देखने के लिए, no one else knows मैंने गलती की ना, हाँ ठीक है कोई नहीं है तो मैं cover up करूँगा. If मेरा नसीब खराब है और कोई भी है, तो then I will either convince them or tell them, hey, keep quiet or whatever else it is in order not to make sure. I think this is what the problem is. Right? This is even commoner, right? It wasn't my fault. It was her fault. She was the one talking to me, or he was the one copying from me. Or, me. Maybe I should just make a list of all the possible reasons everyone has for why you didn't do what you did. We're very good at this, especially when we're young, when we're telling our mother why you didn't do well, or your dad as to why you bunked the class or whatever else. And we get a little more creative with time. I think this is what I'm trying to emphasize. It doesn't matter when you make errors in some settings. But when you're a doctor and you're responsible for taking care of patients, it makes a world of difference. And I think this is something that all of us forget. And it's true that I forgot. When I was a medical student, I was a doctor or whatever else, I thought the world revolved around me. As a doctor, I thought I was the most important person in the room. And sometimes being a doctor goes to your head. Why does it go to your head? Achilles, what's your name? Archive. Okay. Why does becoming a doctor go to your head? Sorry? No, but when you become a doctor, why do you think you're God's gift to mankind? That you know everything, patients are stupid, other doctors are stupid, and no one knows anything else. Actually, your experience will teach you humility, because it will teach you how many mistakes you made and how little you actually know. I honestly think the purpose of a medical education should be to help you identify your areas of ignorance, not your areas of knowledge. Because really, the knowledge is just a small island in a vast ocean of ignorance. Why is it helpful to know what you're ignorant about? Yeah, I think the book stand, the blue shirt. I think you're quite right. I think the most important thing is you need to understand, and I think this is something we forget. Half the things we're going to teach you in medical college are wrong. But we don't know which half are wrong. Let me give you an example. 35 years ago, when someone had a peptic ulcer, we had this standard teaching. Peptic ulcers are because of hurry, curry, worry, stress, all that good stuff. And then when people would have a problem, you would tell them to take a holiday. We would do all kinds of surgery. We would cut the vagus nerve. We would remove the ulcer and stuff like that. No one does that anymore. Why not? Because now we know that peptic ulcers are actually the result of an infection by H. pylori. Now we treat them with antibiotics. What does that mean? That means for 30 years, all hospitals all across the world were providing the wrong medical treatment for all their patients. Scary, isn't it? But trust me, you guys are nodding your head, yeah, what idiots those guys were. You guys are going to be equal idiots, trust me. I'm an equal idiot and I still make mistakes. And I don't make those mistakes deliberately, but I don't even know they're mistakes. But I'm willing to keep an open mind and accept the fact, yes, it's possible that I'm making mistakes, and that's the only way to learn. So why are we reluctant to report? And this is a typical iceberg phenomenon. A lot of the errors are not recognized, a lot of them are hidden, a lot of them are disguised as being something else. Everyone put it passing the buck. And often we don't even know. Suppose tomorrow you see someone make a mistake. A lot of the time, it's not my business. Let them handle it for themselves. Even if you see an error, you don't know who to tell or what to tell or whatever it is. And I will tell you one thing. As medical students, once you start your clinical term, you will start attending ward rounds. And you will see these mistakes being made. I'm telling you right now. I mean, that's just part of the beast. And ideally, that's the value we can add. Because you're looking at life through a completely different lens. You're not jaded. You're not already being as brainwashed as I am brainwashed. You will think, hey, maybe there's a better way of doing these things. So when you come up with stuff like that, this is what we call an unmet clinical need. When a patient is in bed and the patient is trying to get the nurse's attention, why is the patient having such a hard time doing it? Is there something we can offer the patient so the patient can actually get hold of a nurse's attention? A lot of these are solved problems, and you will see a lot of these opportunities, so please keep up. I think this is something we need to understand. That an error does not happen because the doctor was stupid, or the doctor was careless, or the nurse didn't know any better. An error occurs because the system allowed the error to occur. Now, this entire concept of the system may sound very foreign to you, but let me give you an example. Suppose tomorrow a patient dies, an asthmatic kid dies in the emergency room because there was no oxygen available. The parents will then sue the hospital, and the doctor will say, the lawyer on the other side will say, the doctor killed the patient because there was no oxygen available. Yes or no? Would you agree with that? If you were the lawyer, that's what you would say. But when you do a root cause analysis, has anyone heard of these words? Where you ask the 5 whys. Why was there no oxygen available? And there was no oxygen available because the administration did not provide the money for enough oxygen cylinders. So when there was that one oxygen cylinder in the emergency room and that oxygen cylinder got over, no one knew that oxygen cylinder was over. But who pays the price when that kid dies? It is the doctor on duty. For no fault of his is what I'm trying to tell you. But I think sometimes doctors deserve this. I know you can't see the tie, but it says, I don't just act like God, I am God. In a hospital setting, because there is this one doctor, there are these 10 junior doctors. Today now you have 20 junior doctors running around after that senior doctor. And then there are 5 nurses, and then there are the patients, and then there are patients' family members. And then you say, Doctor, मेरा patient ठीक है कि नहीं? मेरे patient को क्या होने वाला है? Doctor, आप भगवान हो. The problem with the doctor आप भगवान हो is जब तक सब कुछ ठीक है तब तक आप भगवान हो. कुछ भी problem हो गया ना तो आप ही शैतान बनोगे. Just remember that. So please make sure that your patients have realistic expectations of what you're doing. Please don't let this go to your head. So this is not something which you as a medical student can do. But at some point you're not going to remain medical students all your life. Hopefully at some point one of you will become the deans of this hospital. One of you will become the health minister. One of you will become something or the other. You will have positions of power. And remember that don't beat up on doctors. When there's a problem, it's always a systemic problem. You need to address this. And this is a simple acronym which can be used. Always automate as far as possible. So there's less scope for human error. Always standardize. That's the importance of having checklists. Simplify. There's really no reason for levels of complexity. And it's a good idea to have rehearsals and stress tests. So one of the reasons I came 15 minutes early for this lecture is that I don't want to walk into a lecture, then have problems, and there are, let's say, 60 kids here. For every 5 minutes I take to set up, I waste 60 people's time into 5 minutes. That's 300 minutes. That's 5 hours, which I don't think is fair. It's better for me to come 15 minutes in advance and make sure that everything is working. That's called a stress test. As Jeevan said, that's the safety net, that's the redundancy check. In case this doesn't work, we had a backup. That didn't work, we had a backup. And then we had an alternate backup. And again, remember, you don't have to do everything yourself. It's important to be able to work as a team. And sometimes we forget that. Sometimes you think, oh, I have an MBBS degree. That other lady is just a nurse. She's just an RN. What does she understand? Huge mistake, trust me. Because honestly, nurses are far better than doctors at taking care of patients. Tell me why? Since you're nodding your head, yes. Why are nurses better than doctors at taking care of patients? Full marks. Because they care about patients. They do it on a daily basis. They're not shielded from patients. They're the ones who change the bedpans. They're the ones who take the calls in the BP. They're the ones who are impassionate and kind and compassionate. And that's definitely something we can learn. So, even if you learn nothing from all your medical professors in these lectures, the one thing I would tell you is please learn from your patients. That's perhaps the most important thing. But please learn from the nurses because they've got a lifetime of experience. And if you respect them, the amount they'll be able to teach you will be far more than any medical book will ever be. But honestly, working under this situation, there are so many patients, and at some point, hopefully, you guys will start going to the OPD. And again, you don't need to wait to go to the OPD. It's a public hospital. Anyone can go where they want. I would strongly encourage you spend your evenings in the wards, and because you're a student, people are quite happy to welcome you. They're happy that you're taking the initiative. They're happy that you're willing to do things. You will learn so much, and you will realize how hard it really is, especially in a place like JJ Hospital. There are so many patients where there isn't enough money, when there's not enough staff, how to cope. And it's really a miracle that more errors don't occur more frequently. I think this is something we forget. Every time there's an error, if you have half a conscience, and I think the very fact that you're medical students means you do have a conscience. This is what happens. Of course, what happens to doctors is what the rest of the world does to us. There's bullying, there's shame, they lock them up, the front page, every newspaper. What about the doctors? This is something you need to remember. I'm sure it's already happened to you. Suppose you did study for an exam and you didn't do well in the exam. How would you feel? A lot of these things, right? You'd blame yourself. I wish I hadn't gone to the party. Oh God, what will happen for the next exam? You'd be ashamed. What do I tell my parents that I've done so badly? And so many different things. The point is that there's good you can learn from an error, and there's the not so good stuff. That's out. This is actually much harder, especially when you bottle up the error, especially when you inadvertently cause harm, but you didn't have the guts to tell anyone. So you can't really share some of that guilt with someone else. Then you have this frustration, you keep on playing in your mind, am I really good enough to become a doctor? Will I never become a good doctor? And there is a reason why there are so many suicides in medical college. Because when something goes wrong and it all gets bottled up, and everyone then picks on you, oh, this was the guy who killed the patient, this is the guy who botched up the surgery. It will be extremely hard. As it is, you're beating up on yourself, and the rest of the world makes it even harder. And that's why it's very hard for us, which I think is such a shame. Because all of us are human beings, all of us will make mistakes, all of us are emotionally vulnerable. Please remember this, that if you make a mistake, it's hard. If your friend makes a mistake, that's hard on your friend. Please be available to support them. It's the elephant in the room, but don't try to hide it. Talk about it so they have a chance to be able to help. Next. And as I said before, the most important thing is first be kind to yourself. Shit happens, that's the reality. Just because it happened once, as long as you learn the right lesson, you'll be much more successful the next time. All of us have made mistakes. Just because you made one mistake doesn't make you a bad individual. And again, this is what the second big thing is. And the important thing is not to keep on dwelling on your mistake. You need to be able to be resilient. That's one advantage of having grey hair. The one with the check shirt. What's the advantage of having grey hair as compared to having black hair like yours?
Experience and knowledge. Both.
I've made many more mistakes than you've made. And hopefully I've learned from them. Hopefully I haven't. I don't know that as yet. But just because I've made so many more mistakes, I'm a lot kinder when someone else makes a mistake. Because I can remember very young, when I was that guy's age, I'd actually made worse mistakes. This is what I need to be able to do. So culture is a very difficult word for most people to understand. And very honestly, it's not a word which I understood. But often the culture in a lot of institutions is quite toxic. It's very negative. It's very competitive. Not even amongst students, but even amongst professors and teachers, there's an authority. Can I go back? Right. So again, these are important words. And I don't even expect you to absorb all these words or even understand. One of the reasons I'm bringing up these words is hopefully after 2 years you remember, hey, that tall guy gave us a lecture and this is something he talked to us about. I remember hearing about what an open culture is. I remember hearing about what a just culture is. And these are valuable. And these are some of the things. The most important thing is the learning culture, which means everyone says, yes, it's fine, you made that mistake. This is what we need to do to make sure that it doesn't happen. This is, again, a very classical model. I never learned about this until I actually wrote a book on patient safety and medical errors. Because no one ever bothered to teach us about patient safety or medical errors. It wasn't part of the syllabus. It just wasn't one of those things because it doesn't fall under anatomy or pathology or surgery or medicine or anything else at all. So it's just a topic which is not addressed. But what does a Swiss cheese model mean? A Swiss cheese has multiple holes. Now it doesn't matter if there are. The projector doesn't like anything I'm saying, obviously, so it's not looking. I don't even know if I can do it. Can I? So the whole point is there are multiple holes. Now, it needs 5 holes to be lined up for patient harm to occur. So even if there are 2 holes which are gaps, but the other 2 are fine, those act as barriers or safety net. So ultimately the patient doesn't get harmed. And I think this is what the biggest problem is. It's that the people who are actually responsible for the fact that there was no oxygen in the oxygen cylinders, which is the administration, the health minister, the people who release the budget, the people who are responsible for maintenance, the technician, that's the front end of the system. They never get into trouble. It's always the sharp end of the system who gets into trouble. And guess who's at the sharp end? The doctors and the nurses and the juniors. And the more junior you are, the more likely it is they will hang you out to dry. So the senior professor is never available on campus. It's always the junior most guy who ironically knows the least who will get into trouble. And that's all a result of an unfairly set up system. And again, this is called the fishbone or the herring diagram, which talks about errors being systemic. And it's at multiple levels. It's not just the people, it's the lack of communication. It's the fact that procedures weren't more importantly, the fact that the cycle than the patient ever knows or the patient ever cares to. But the patient knows a lot more about their body, the patient knows a lot more about their illness, and the patient knows a lot more about their preferences. And doctors aren't mind readers. And the more you respect the patient, the more of an effective partnership you'll be able to form with the patient. And you'll end up learning a lot from the patient. And I treat all my patients as unpaid research assistants. Can you explain that? You know, good thing I should just point a finger at there, hopefully someone will stand up. Yeah, that's it, yes. Well, how do I treat my patients as unpaid research assistants?
You get to know about more diseases.
I tell all my patients, look, all that information is available on the internet. Anyway, please go hunt for it. And if you find it and you find it's exactly what I've told you, that's great. That just confirms the fact that you should trust me and I'm giving you the right information. And if on the other hand you find something which I didn't know or something which disagrees, please come back and share it with me and I'll tell you why that other doctor was an idiot or perhaps why I was an idiot. So we all learn. I think this is really important. Don't underestimate the role. And it doesn't matter if you're a medical student who's raw, and it doesn't matter if your professor has 30 years of experience. He could have 30 years of experience of doing the wrong thing. I just explained to you. All the GI surgeons who were treating peptic ulcers had 30 years of experience of doing unnecessary gastrectomies. So that's perfectly fine. You know, just assume that yes, I'm smart and I can figure it out. All of you know what, does anyone know what the law of entropy is? Yeah, you passed hopefully your 12th standard. He's shaking his head. This is the typical Indian head shake. It's never like this. It's like a doll head shake. So I never know whether it's right. But still, yeah, go ahead. What's the law of entropy?
It's disorder.
Yes, what is the law?
It doesn't increase.
Huh?
any system likes to go to disorder rather than
Perfect, excellent. Yeah, so that's a natural state, and that's what happens inevitably. How do you break the law of it? You don't really break the law. What's the exception to the law? That as this is true only when you're talking about a closed system. The moment you have an open system which has a source of energy, which in the case of the earth is the sun, then that law of entropy no longer applies because now it's open and open system. And that's exactly what we're trying to say. There is a natural tendency to leave things alone, for things to go wrong, but human beings are the ones who carry the energy to change that. Again, all you guys love mnemonics, right? You all know. Does anyone know what the mnemonic for the solar system planets is? Or you all forgotten this word solar? We have a solar system. Anyone know the names of the planets and their order? Go on. Pluto isn't a planet anymore. So what's the mnemonic? What do you use to remember it?
I just remember it.
Wow, he's got a better brain than I have.
I am very educated. Just that.
I'm just trying to get that that's it. And everyone loves mnemonics. It's an easy mnemonic. This is a mnemonic you need to teach your patients. You need to teach them. Because I always tell them, boss, the more you know, the better for me and the better for you. And this is easy enough. Patients need to be aware. You don't need to scare them. You need to tell them, look, please speak up. And if you have the courage to speak up, you'll be able to transmit that courage to your patients as well. This is much better for your peace of mind. As Madam was telling you, everything I've said is actually on this website already. So even if you haven't paid any attention, or even if you slept through this lecture, honestly, don't worry. And it's perfectly okay. Maybe this will be useful 2 years down, or maybe useful 4 years down when one of your patients has an error, or you've committed something. That's the time when you'll go back. See, a lot of the problems with traditional education systems is what is called just-in-case learning. Does anyone understand what just-in-case learning? Just in case you need to know what Newton's law is, or just in case you need to know what a Pythagorean theorem is. You mostly never need to know it. But hey, guess what? I'm going to ask you this on the exam, so you better know it. That's called just-in-case learning. What we're trying to encourage is just-in-time learning, which means that information should be available to you when you actually require that information. Because when it's available to you, when you require that information, you will never forget it. Trust me. Is there a follow-on lecture? I have 10 minutes now. Again, you can skip a lot of this stuff, but I'm just trying to tell you why errors are so surprisingly common and why it's amazing no one ever fixes any of this. This is called LOSA, which is confusing drug names. And you've all read the argument about generics versus brands. No one tells you this, that brand names deliberately create confusing brand names, which actually cause a lot of errors. And that is called LOSA, look-alike or sum. Can anyone differentiate between any of these drugs? I can't. You're likely to pick up something and actually they're completely different. The packaging is the same, the branding is the same, everything looks the same. And God forbid if by mistake the patient goes to a chemist and obviously your handwriting is illegible, right? My handwriting is illegible. Even I can't read it sometimes. Sorry. And he gets the wrong medicine. What do you think is going to happen? Your patient is never going to get better. And you will never even know why your patient is not getting better. This is what I meant about a system which is designed to breed errors. It's not the chemist who's to blame, it's not the patient who's to blame, it's not the doctor who's to blame, it's the system which is completely broken. There is things that you can do as a doctor, and it's stuff you need to do, and I think the National Medical Council is now insisting that please prescribe a generic. We're not doing it to harass you, please understand that. We're doing it because it's the right thing to do. And again, legible handwritings, preferably, now everything will get printed out. Make sure it's in capitals. Next. She's making errors too. Can someone do something about the errors? Right. Okay, so again, yes, I think this is important. And honestly, I would trust. Even if the patient says, doctor, I have a bad feeling about this, or if a nurse says, I don't think this patient is doing well, irrespective of what the reports say, I would pay attention to what she has to say. At least if nothing else, go back and look at the patient. this is unfortunately what happens to most of us. I'm sure Madam will agree with me that rather than spend time teaching patients, we're spending so many times filling up these stupid forms. Attend PR के लिए कितना attend PR कितने marks. Okay, so here we are. And this is what we're trying. This is what Seegal and Shreya. Okay. Seegal and Shreya run M.I.C.E labs in JJ Hospital. It's the only lab of its kind in the country. M.I.C.E doesn't have mice running around in the lab. And it's not like you guys are the mice either. M.I.C.E is an acronym for Medical Innovation, Creativity and Entrepreneurship. And our hypothesis is all you guys were bright enough to get into IITs. If that's what you wanted to do, like you can tinker, you can engineer, you can understand some of this stuff. But now that you've chosen to go down the medical route, you may not get this opportunity. We're trying to help you do that. And this is what we think. That, fine, obviously you need to understand your textbooks. But you cannot restrict your learning only to medical textbooks. Because your medical textbooks are going to become obsolete or irrelevant. And whatever worked in the past will not keep on working in the future. We need you to be able to think beyond the textbook. And I love this. And I think this is the big difference between the way doctors and engineers think. And doctors will treat one patient at a time. And that's right, and it is the right thing to do. And when that patient is sitting in front of you, that patient is the most important person in the world. Irrespective of whether your boss is shouting at you or your wife is screaming at you or anything else at work. Focus on that patient. Always saying after you finish seeing the patient, you then apply an engineering mindset and think, there must be 100 other patients like this guy. What can I do in order to address that? That's the approach. Again, M.I.C.E Labs has a website. There's actually, which floor are we on? I would encourage you. The trouble is, we all encourage JJ students. We all tell them how lucky you are and how privileged you are to have a M.I.C.E Lab. How many people actually come? 0. Tell me why. Tell me why people don't come to the M.I.C.E Lab. Green shirt. Sorry? I gave you the information. I give this every year. Sorry? Because of?
It's for the first time I got information
Yeah,
about
yeah, that's fine. But you have 5 years more in this medical college and you will end up going 0 times to the M.I.C.E labs. Why? I'll tell you why. Because it's not going to appear in your MCQ exams. And for the next 5 years, all you guys are going to care about is passing MCQ exams. Yes or no? Because that's all you've done for the last 5 years of your life. If that's all you've done for the past 5 years of your life, what do you think dramatically will change just because you got into JJ Hospital? Nothing. Now that you've passed this particular set of JE or NEET or whatever the name of the exam keeps on changing, now you'll worry about the next set of exams. Oh, I want to become a cardiologist, so I need to sit for the USMLE or the, again, I don't even remember the names anymore. So there'll be some exam or the other, and the only way to appear for the exam is to sit in the library and read all the notes and cram all the answers so that MCQ exams. I hope you don't just remain good at passing MCQ exams. Will your patient come to you with an MCQ exam? Yeah, the patient won't come and say, doctor, please pick one of the following. I have diabetes, I have this. It's not going to happen. So please trust me. I'm not stopping you from studying. But the best place to study is not just the library. The best place to study is at the patient's bedside, and everything the patient teaches you then go back to the library and then study. This is the other thing we've donated to the JJ Hospital. And you'll say none of us knows about it, that's fine. At some point someone will show you the medical library, show you where it is. And we were so disappointed that the JJ Hospital did not have PCs. We said, how can you have a library without PCs? I think all the books are now irrelevant. People need access to the latest information. I have a request. Every time you go to a patient in the ward, and please start going now, there's no reason for us to take you there. It's a public hospital, everyone's welcome. Carry your tablet with you. Why? This guy's sleeping, I should wake him up and ask him. Who's sleeping? The guy who's sleeping, will you stand up? Sorry. Alright, why should you take your tablet when you go to the, you should take your tablet to the lecture hall, definitely. Why should you take it to the ward?
gather information.
Sorry?
First of all, note taking, and second, if it tells some disease or illness, we can search it on Google and all. We can refer to it and discuss with them.
Perfect. And yes, in case you don't know, there's a resident, there's a junior doctor, there's a nurse. And the best time to actually hang around in the ward is 10 p.m. Why? Why is it 10 p.m.?
We all knew.
Well,
Nobody else is there. No limit.
it's a quiet time, the doctor has time to talk to you, the nurse is getting bored, it's a night shift, all the patients are want to sleep. I'm just trying to tell you, so you need to carve out these times. So you're going to then be different from everyone else. And this is the stuff which is. The best thing is to go with a group of friends. Take two friends and learn each other. I think this is my most important slide. And it's interesting. I think the first thing to be a successful medical student is to have your own website. Anyone as to why you should have your. How many people here have their own website? What's on your website? You don't talk. What's on your website? What's your domain name?
Fog in the Woods.
Sorry?
Fog in the Woods. It's a WordPress blog.
Okay, and why do you have
I
a
just like stories on it.
well, no. You know what she's doing different from all you guys? She's creating a digital brand for herself. And this is something which will remain with her for the rest of the life. How many of you have LinkedIn profiles? You know, if this were an engineering class, there would be no one who would not have put up their hands. You can't afford to live in the past. You need to be thinking about where you're going to be 4 years down the road or 5 years down the road. You're going to be competing for jobs, you're going to be looking for residencies, you're going to be looking for internships. And the first thing someone's going to do when you apply is what? Sorry? LinkedIn may be obsolete in the next 5 years, who knows? But they will Google your name. Maybe Google will be obsolete. And what is the first thing they'll find out? Hopefully it won't be your Instagram account of photographs of your boyfriend and your girlfriend. Hopefully, but it might very well be. The point is, if you have your own website, you control your own digital business. And the good thing is, websites are free and it literally takes you 5 minutes. And if you don't know how to set up a website, please talk to Zee. We'll be happy to help you set up. And that website will help you all the rest of your life. You can archive what lectures you attended, what you learned, what you studied. You can go back, you can refer to it, 50 different things. When I say teach what you learn, it's not necessarily just your friends. Teach your patients. Teach them what you're doing because you have the time, you have the energy. And you know what? All the compassion has still not been squeezed out of you. Because the trouble is medical school will dehumanize. That's the nature of the beast. There's so much to study, so much cramming, so much competition, that often all of us end up becoming a little unkind. It's not relevant. That is the nature of the beast. Hopefully help you understand. Teach to other students. But I think the best thing is to teach to your professor. How many of you have ever taught anything to your professor? What did you teach him?
I was like studying about fluids, and there was an argument regarding the dynamics of the fluid, turbulent fluid. So he taught us the wrong concept.
This is Bernoulli's?
No, the Reynolds number thing. So he taught us the wrong thing, and I looked up in the Alan Akash modules. And I told him that there are mistakes he had made, and he rectified that and took my name in all the branches that was a mistake.
Well, no. Unfortunately, you will not often find professors who are open-minded and are willing to be respectful. But if you find someone like that, that person is worth their weight in gold. And I think that's right. Ultimately, how will professors ever improve it? No, just because I'm a professor doesn't mean I know everything or I've finished learning. We will all remain learners all our life. And we will all remain teachers all our life. And just because you happen to be younger than me, doesn't mean that you can't teach me. Doesn't mean that I can't learn. If I can't learn from you, the fault is mine. How many of you know about this site? That's all. How many of you use this site? What do you use it for?
I use it to download PDFs of
Of
books.
what? Which books? Storybooks? Virtue books?
Sometimes fictional books and recently Grey's Anatomy.
Full marks. I'm happy she reads poetry. I'm happy she reads fiction. Don't think that just because you're a medical student, your world is going to end. And you will learn far more about empathy and compassion and medicine by learning medical literature and humanities than you possibly will in a medical textbook. This is great. And this is just unbelievable. And I cannot, if I were in charge of Akash class or these stupid tuition classes, I think this is the only slide I would say. Please don't come to any of my lectures. Please, any book you want, any book you want in the world is available here. Download the book, read it. You don't understand? Then come and ask. You know, I'm very allergic to spoon feeding students. I'm very allergic to teaching them stuff if they can learn for themselves. Because if they can learn for themselves, they're much more likely to remember it, and they're much more likely to teach you. How many of you use chat? You put your hand up. You put your hand up. Did you put your hand up or not? I want to talk to someone who did put up their hand. The green. Yeah. Why don't you use ChatGPT? Sorry? Can anyone explain to me how anyone can not be aware of ChatGPT? Sorry? You read a newspaper, you talk to friends. How can you not know what ChatGPT is? It is the one app which acquired the largest number of users in the shortest amount of time. Okay, fine. Honestly, don't attend any lectures. Please, it's free. Please attend this. It will answer all your questions. And a far better professor, tutor, teacher than anyone else. Trust me. It's patient. It will answer your questions as many times as you like. And the better you get at using ChatGPT, the better the answers will be. Again, like I said, everything I've told you, I'm sure you've forgotten half of it, and that's perfectly okay. All of this is on the website. And that's actually my last. This could be me, this could be you. Actually, at some point, this could be you in the future as a doctor, and this will be your patients.
You have really given lots of tips and hope so all of our students follow them. Believe me, students, and each and every tip and each and every sentence sir have discussed and spoke to you is very, very important to be a very good doctor. So just follow whatever sir has emphasized, whatever sir has told. Especially you have to do your internship, you have to be more friendly with the patients and learn more from patients. So today's lecture was really very much helpful, sir. And we would just like to thank you, sir, for this all fulfilling.
You know, the photographer is the most important person in the room. You know that, right? If you get married and the wedding photographer is not happy with the way you put the garland, they'll make you do it twice and twice. Thank you so much for being such a patient audience.
Questions?
No, what I had done is, I actually had a couple of gifts to give for someone who asks the best question. I don't know whether we had enough time, that's the reason I was doing this. When's your next lecture?
Yeah. Yeah.
2 books. One for the first 112. 2 books for the and then decide. Yeah, go ahead.
Sir, I'm interested in doing research along with MBBS and for my post-graduation as well. So can you tell me how I can go about it with my lab? Explore same building.
So
Like
this
I
is
can get to participate in research.
This is something we've been doing for the last 5 years. We want people like you. We want people who want different stuff, and we are very, very happy to be able to. She gets it. So thank you for providing a little more awareness about my stuff.
Just like this, like I could have been an ideal, but I like
Yeah, but that's-
and I like started from like right now.
Of course, you don't have to wait for an invitation. It's
Today's the
a
thing,
thing.
and I come.
Better give everyone an engraved invitation. And hopefully they come. I think maybe that's what we need to do in all the new students. Please attend. Maybe we should give them a visa practice. Motivate them to come. And why do you need permission from us? Will you please remember one thing? Hospitals exist only to take care of patients. Yes or no? Medical colleges exist only to educate students. Yes or no? You never need to ask for permission. We exist only to serve you. Is that clear? And if you're worried, then it's far better to ask for forgiveness rather than to ask for permission. Does that make any sense? So you are here. Yeah.
Sir, I want to do business in medical field, but I don't want to do the business with patients. So can you?
Sorry, say that again.
I want to do business in medical field, but not with the patients. How can I start? Like I want to start.
Again, she's the right person. See, my point is you're never going to think of something that someone else hasn't already thought of. So, basically what he's talking about is non-clinical businesses. Businesses which don't interface. There's so many options, whether it's medical equipment, whether it's medical diagnostics, whether it's pharma, whether it's do your own. I think I'm glad that people are thinking outside the box. And it's important, and I think that's one thing I start to be able to do very well. We don't want to put you in that box. We want you to think. Because
How can I start? Like okay, I will.
is the problem with sitting in the wrong place. Maybe you deserve the punishment, so you won't take it the next time. I think that's fine. Hopefully you can talk to someone else who wasn't sleeping and they'll be able to share. And it's a good idea to ask questions after the lecture, not just of me, but even amongst each other, because it will help you to reinforce what you remember and what was good. As a next lecture, next lecture. But then I'm sorry, I don't make you feel sure.
I want, now that you have created a slight introduction in us about M.I.C.E lab, I wanted to know more about it regarding what stuff are we doing.
That's what the website is for. But don't walk in now. Again, I told you before, I refuse to teach people stuff they can learn from themselves. I'm allergic to school. If you can't find out your answers, go ahead. If you can't find out your answers and then get stuck, then escalate to me. But not otherwise. What you're saying is doctors do make errors? Of course they do, and that was part of what I said. I said it's not fair to talk all doctors with the same brush, and the number of times when an error becomes because of deliberate negligence is very, very few and far between. Most doctors are not wicked. None of us became doctors. Okay? I think her question is, I think her question was what happens when doctors intentionally do stuff in order to make more money or to do stuff. And I think you're right, that is the elephant in the room. Do I have a solution for that? No. I'm hoping that as a result of becoming a doctor, you will have enough good role models and you will pick up what is right. Because your first responsibility is to your patients. But there is no certainty that will happen. So my philosophy now has changed a lot. I think there are two kinds of doctors. Good doctors don't need to be told anything because they're going to do the thing which is right because their parents have brought them up well, they understand what's ethical, they understand what's not ethical, so they'll be sorted. Are bad doctors going to improve because of a lecture I give them? Forget it, nothing's ever going to happen. So I stopped talking to doctors. Now I only talk to patients. And the only reason I talk to patients is just to teach them what. You know what I mean? Can a patient treat himself? No. So what's the one thing I teach the patient? I teach them how to differentiate between a good doctor and a bad doctor. And that's the only thing I do. And the only way to find out a good doctor and a bad doctor is to ask questions and see how respectfully the doctor answers your questions. Now, if the doctor says, oh, don't ask me questions, I'm too busy, or you go back to Dr. Google and find your information, that's a bad doctor. Because that doctor is disrespectful. The doctor has no business listening. And if he's so busy that he doesn't have time to take care of you, walk out. Fortunately, in India, there's no shortage of patients and there's no shortage of doctors. So don't get attracted by the biggest brand name doctor just because he has the brand name. He may actually be the worst possible doctor because he's arrogant and doesn't have time. My point is don't allow doctors to cheat. What I'm saying. I think that's it. So don't treat yourself as a victim. Don't treat yourself as a victim. Can I ask you one question? Is there any reason why your medical education should be any worse than the medical education student at Stanford Medical School gets? It should actually be better. Why should it be better? Okay, so the education which I got, I passed out from Kenya Hospital. Then I went to Johns Hopkins and Harvard. And I always had an inferiority complex. Our libraries didn't have all the books. The ECG machines never had any paper. The X-ray machines didn't work. You actually had to go, do everything yourself. That's fine. When you go to a place like John's, it's literally like a 5-star hospital. Everything's air conditioned. All your professors are medical school, textbook authors. The patients are all, highly informed. So I had a major inferiority. I don't have that inferiority complex anymore. Because I think now a lot of the Western world is moving on. It's becoming an aging population. I think this is a real golden opportunity. Because we now have a demographic sweet spot. We have young people like you. And you can always buy robots, you can always buy computers. That's all technology. But you can't buy people. You can't buy intelligent, hardworking people. That's our magic. And the reason why I think you have a better shot is that all the textbooks now are available. But more importantly, you have a cohort of 150 other bright students. And like someone said, the reason you go to Kota is because there'll be other guides taking you on and pushing you on. Whereas in Stanford, they only have 40 medical students in the batch. Just the fact of numbers, but you need to convert that quantity into a strength. It's not a weakness. That's it. Yeah? Okay, guys.